Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Welcome back to our program this morning. I am really delighted today to have two very special guests, along, of course, with Doc Hawk. You'll notice he is not seated to my right today. He's in Studio B and will be joining us as we review our numbers in just a moment. But I want to introduce a couple of folks. On my right today is Dr. Danielle Johnson, who's a psychologist here at KU and who specializes really around early childhood development and some of the mental health effects on children. And we want to kind of have an important conversation today. I think that there has been a lot of social isolation that has occurred around COVID-19 for all of America. But in many ways, Black America has felt isolation for a very long period of time, and it's not just COVID. We're going to kind of delve into what does it mean to be excluded from the mainstream of society. On my left is my daughter, Sierra Stites. Sierra is an MPH student here in the School of Medicine, and she is also on the Executive Vice Chancellor's Cabinet for Diversity and Inclusion. But Sierra is also a biracial person. My wife is African American. Obviously, I'm not. And we have three wonderful children. And Sierra has been working this summer with KDHE as part of her summer internship. And she's done some work around trying to help case manage individuals who have been affected by COVID. I thought it would be an interesting conversation this morning to think about how COVID has affected America and how some of the other events in our country right now are bringing to light the effect on minority communities. This is a healthcare show. We're not going to get into a lot of social justice issue or protests and things like that, but there are healthcare ramifications to societal issues without question, just as there have been to COVID. What I want our audience to feel at the end of the day is something that I've felt as a white guy with a black family. And that is that society isn't the same. And that exclusion takes many forms every day. But first, Dana, let's talk about the numbers. We do have some good news.
We do have really good news. Our numbers in the hospital got down to 10 patients in the hospital with COVID-19 infection. Since that time, since yesterday, we have had a few more admissions, though. Currently, we are at 13 patients, with 4 of those needing critical care services. However, we only have 2 on the ventilator. So I think it was really good, and we were really happy at 10. But of course, we are still seeing some admissions. So hopefully over the weekend, we can continue to keep very low numbers.
Right, so that's great, and let's hope things are going well. So Danielle, talk to us just for a moment. What is it that you're working on a regular basis and the type of folks you see?
Right, so I primarily spend my time in patient psychiatry. I'm working with adolescents from ages, our youngest is 5 that come into Marillac, and our oldest is 17. So I do consultation work regarding psychological assessments, behavior plans, and therapy services to address the psychological and psychiatric needs of adolescents. We see a diverse range of kiddos in our hospital that have a laundry list of psychological needs and social services, lack of resources, and that's, I think, really targeted at some of our minority populations who we know research shows that minorities are less likely to get psychological care, but more likely to be diagnosed with schizophrenia or psychotic episodes than our non-minority population. And so there is this struggle that we have with having kiddos that are of the minority population who often go into service providers who do not look like them. And that is a difficult barrier to breach because there's this shared understanding, despite our backgrounds and being different, there's an inherent understanding of things because we are a minority population. And so we've got barriers to access to resources. And so when we do see some of those kiddos, and I also see adults on the outpatient side as well, and historically I've seen adults and kiddos, when we do see some populations, they are much sicker, akin to COVID right now, that people do come to the hospital because they've been putting off healthcare because of fears of COVID, and so when they come in, they are much sicker. And I think psychiatrically we're seeing that. We've had kiddos home since March 12th, 11th, and they have been socially isolated. They have been doing schoolwork from home, or attempts to do schoolwork from home, without seeing their friends, without seeing their teachers, and Zoom is a great, and we appreciate that technology, but it doesn't meet all the needs of actually seeing, touching, feeling people. And so we've had these compounding issues of being at home and then having the world happen as it always does, that have made, I think, for the opportunity for just really elevated distress. And we think about the ACEs study, which is looking at adverse childhood experiences, and we think of trauma as being someone being shot, someone being hurt, rapes and murders. And I think we're living through this traumatic experience right now with our youth, and for the adults. I think I'll speak for all of us. This is traumatizing in some regards, being isolated and not knowing when the next wave will come or not knowing when social things will happen. We find ourselves really at a loss for what to do because we don't have control. We don't know when COVID will end. We don't know when things socially will kind of simmer down. So we're all in this kind of lack of knowing, and that unknowingness can be very difficult for us. And so when you think of a child who has less coping skills and less brain development, they're really at a loss. And so we are doing our best to put Dr. Douglas, who's our medical director at Marillac, has been on the news a couple of times to make it quite aware that we are concerned with increasing risk of suicide attempts and increasing suicide completions with our youth and adolescent. And so we're really trying to get in front of what may come with ongoing social strife and ongoing medical concerns to make sure we keep our youth and our adults healthy and safe.
You know, and I think at one point our suicide hotline calls were up like
Yes.
8,000%. I mean, that is stunning. And just as a comment, you know, unemployment at 15 to 20%, that's a stressor.
Yeah.
The rate of suicide was really high in the Great Depression when unemployment
Correct.
was high, and
Correct.
I think we're seeing some. I mean, it's
there.
Yeah, unemployment,
Yeah.
lack of income, social isolation. Yeah, that's bad. That's
Yes.
like really bad.
Yeah.
And then thinking kids are immune to that, probably not so much. So.
I mean, if you think of you've got children, I've got
Right.
little ones, 4 and 5-year-olds, they watch the news, they hear things, they see things, and my little one has talked about, you know, people outside should wear masks or not being safe. He's 5. He's quite aware of some of the social struggles that we have right now, so I don't think our children are immune. Our children are quite bright, and they pick up on things very easily, so it trickles down.
You know, I know that I've been blessed to be able to come to work every day. And because I can come to work every day, I don't feel as isolated, but I know our patients often have felt isolated here at KU, and that's been a real struggle for a number of our patients. And we did that because we were trying to keep our PPE amounts intact and make sure our patients stayed safe, make sure our staff stayed safe, and I think we've been able to accomplish all of that. And I think all hospitals have done the same thing because we really had to keep people safe. Now with the effect of the initial surge has kind of passed. Again, our numbers are down to 10. We're very concerned about the future as society reopens up, but we are about to announce a pretty big change, and up in our hospital right now, we have a couple of folks who are going to visit with us about that. Jessica Lovell and our Chief Operating Officer of the Kansas City Division, Chris Reuter. Jess?
Hey, Dr. Stites, how are you? You should know by now I have a big smile on my face just for you on this Friday, so happy Friday to you. Quick story, the other day I was sitting at my desk and I was, by mistake, transferred somebody who was wanting to come up here to the hospital and see one of their loved ones, of course. That's kind of a frequently asked question. And I had to explain to her, yes, we have some pretty tight restrictions, and I didn't know quite if she fit the requirement. That wasn't my lane, so I passed her on to the right person, but it really made me realize that it's so important for our public and the loved ones of our patients to be up here with them during their experience here. So I want to bring in Chris Reuter. He is our Chief Operating Officer at our Kansas City Division. How are you? I stepped towards you, but then I have to safely distance myself from you. Thanks for joining us today. So kind of explain, we talk about the word evolution. Well, you seem like that would be over a long period of time, but you know, our visitor policy has evolved over a very short amount of time. Tell us where it was and where it is actually today, what we're announcing today.
You bet. We have had an evolution over the last couple of months, and in March made a really difficult decision to limit visitors to no visitors with a very few exceptions. And we've lived in that world for a couple of months, but what we've done during that period of time is a whole lot of work to make sure that we can best support our patients. And we know that having a visitor or a loved one with you when you're hospitalized or when you're coming in for a clinic visit is such an important part of a patient's experience and just the support that's there. So we have really done a lot of work to make sure that our environment is safe, looking at the physical distancing, looking at our common areas, elevator traffic, cafeteria, all kinds of things, to really be at a place where we believe now, as of yesterday, moving to a 1 visitor per patient per day policy. So we have allowed now 1 visitor for every patient each day. And what we believe is we can do that in a very safe way, bring some visitors back in to support the patients that are here for care.
Well, we know the decision to close our doors temporarily to our patients, loved ones, is not taken lightly. Certainly bringing them back is not taken lightly either. As you mentioned, making sure that safety of our staff and patients is number one. But what is the most important thing you want the public to know about this new change, that we're starting to bring people back? What do we really want to make sure we drive home with that?
Yeah, I think we want everyone to know that it is absolutely safe to come here for care, and it is absolutely safe to have a visitor if you're in the hospital, if you're coming to a clinic visit. With the exception of our cancer treatment and infusion areas, we have patients coming every day, thousands of patients for hospital outpatient visits as well. And so bringing someone with you to assist is just a fine thing. We have taken measures and precautions all across our campus to make sure that we have safety in mind. What we do ask visitors to do is to be screened upon entry, as we've always done, and also to wear a mask and to be cognizant of some of the signage and the cues throughout the organization, letting people know how to stay safe. So keeping that physical distance, making sure that we're not getting more people on an elevator, for example, than we should. And I think the signage and the help from our staff internally will help that become an easy thing for visitors to navigate to our campus.
And what some of our viewers might know is that right below us is our lobby, and it certainly has changed so much just over the last couple of weeks. It's nice to see kind of the sights and sounds of what our hospital has always been, of people coming and going and receiving great patient care. You and I aren't clinical people, so we don't get to see firsthand how important it is when a loved one comes into the bedside to be with somebody during struggles, and maybe somebody's upstairs having a baby this morning. So all these good times, but it's not lost on any of us here at the health system just how important our patients, visitors are, right?
Absolutely not. An absolute essential part of the care that we provide, and of any patient, whether somebody is here for an inpatient stay, they're here for a procedure, a same-day procedure going home, or here for a clinic visit. The support of our loved ones is obviously a very, very important part. So that is why we put the effort into being able to make our environment safe. We know how important it was to be able to bring some visitors back into campus. So we will continue to look, and we're studying this every day. Yesterday was the first day that we brought additional visitors back in. We had teams observing and looking at that yesterday and again today, and we will into the future to make sure that we're staying safe.
Chris Reeder, thank you so much for joining us. I know you're busy this Friday. I'll let you get back to work, and Dr. Stites, I'll send it back to you in the studio with our guests.
Thank you. So important things, because I do think patients and families can feel socially isolated. Sierra, you've done some work around some of this in your work as a student and in your project this summer. Talk to us a little bit about the things you're doing. And I think you've been talking to folks in Ford County, which is a place where there's been a pretty big outbreak.
I have, and so I'm a Master's of Public Health student here at KU, KUMC on the university side. And one thing I've been doing this summer, along with a lot of my public health colleagues, is working for KDHE doing case investigation. So what case investigation is working and talking to the folks who've been tested, who've tested positive for COVID-19, making sure they have the resources they need to get through their isolation, communicating with them about the importance of socially isolating and staying in their homes for the duration of their illness, and then also making sure that their contacts are quarantined as well. So for some families, that can mean quarantining or staying at home for 10 days. It can be 14 days. It can be 24 days. It can be 30 days. So that can be really hard. Dr. Johnson was talking about how children are feeling particularly isolated right now. And if you think about it, if a mom has been tested positive, there's no way she can isolate from her family in her home. And so she has to stay home for 10 days, but then her children and anyone else in her home have to stay home for an additional 14 days. That's a really long time.
That is a long time, and Danielle, I think that's got to be a struggle for a lot of families,
Yes.
especially people who may not have a lot of money or live
Yes.
but check to check.
So limited resources is a struggle at baseline. And so when you find people that have lost jobs or furloughed, and then have children at home with lack of income or limited income, we still need to eat, we still need to take care of our bills. That is a stressor for kiddos. And if parents don't know what to do with their kiddos, they tell their kiddos it's okay. Kiddos can see it's not okay, that there's a struggle there. And so I think it's really important for parents, grandparents, aunts and uncles, who's ever's involved in the lives of children, to make sure they have these conversations of letting them know that this is a struggle right now, to acknowledge the reality. Reality is, yeah, we're having some struggles right now, but we're going to get through it by loving each other and taking care of each other, and being kind and talking to your children about what can we do in our own little bubble when we're stuck in this bubble for 10 to 30 days, which seems unfathomable. What do we do to kind of keep some sanity? And I think for parents to be able to relax and let go and know that your kid's going to get more screen time than you may want them to get, or they're going to have more snacks than you want them to get. But to really lower I say in therapy, to lower the bar, set our bar of expectations a bit lower, because this is a stressful time. And with kiddos now on summer break, which some say March has been the summer break, was the onset of the summer break, I'm really finding ways to be creative and let your children do some fun activities that don't look like summer camp. And for those families that summer camp was never an option, how can you provide some level of support during what is a difficult time?
So comfort foods, when I focus on our snacks, does that mean I get to have more comfort foods if I'm isolated at home?
I think we talk about when you're in college, there's a freshman 15, there is a COVID 15.
Yeah,
that
I
I
think
think we're
that's-
all involved in right now. And it's okay.
It's okay. I should just get that and have fried chicken tonight. I'm looking forward to that with French fries. Yeah.
Acceptance of reality is important for all of us. Reality is we're going to have more indulgences, and that's okay.
I like that.
Moderation is the important piece.
And Dana, we keep saying to people, shelter in place, shelter in place. So it's not like we're telling them to run out and socialize.
Right, absolutely. You know, we've talked about socialization as we've gotten further into this. We've talked about, can you expand your bubble in a responsible and safe way? And encourage people to get out and be active, be outdoors, maintain the social and physical distancing, but you can still have interactions with other people in a safe manner.
Yeah, and I think, and you broke up a little bit, but after 60 days of working together, I'm sure what you said is shelter in place, but go exercise and be safe about it.
Yeah, that's it. Responsible, be responsible.
Responsible. Sierra, you know, this whole social isolation thing, in a biracial family, you kind of have both sides. You're like, well, here's what it can be to be white in the world, but also here's what it is when you're having to isolate, and there are mental health effects of that.
There are, and there are mental health effects of existing in this world as a person of color as well. I'm sure Dr. Johnson can talk to us about weathering, the idea that chronic stress of being isolated, whether it's isolated in your community or if it's isolated at home, has an impact on your health. And that's something that I've seen talking on the phone with people who've tested positive for COVID-19, and it's something that I've seen in my research, and it's part of my lived experience.
So social isolation and being a little invisible is what sheltering in place means. And for some people, that is a lifetime. It's not just COVID-19. Let's see if there are questions out there from media. Not hearing any. Jill, I bet we have some from our listening audience today.
Yes, we do. Community is interested in the topic. One question is, you mentioned words, talk to your kids. Do you have suggestions on language? It seems to be a hard...
That is, and it needs to be developmentally appropriate. So what you say to your 5-year-old should look appreciably different than what you may say to a 15-year-old. But to be able to have an honest conversation and to let your children ask questions. I think we tend to want our kids to sit and we're going to tell you everything, but they have questions. And so to really validate their concerns, because maybe their question is, will COVID, make me sick or make you sick? And if we never let our children ask that question, they're going to be anxious. There's the clinical term.
So Daniel, you use a big word, not a big word there. You used an important word, as I'm trying to say, this word about validate. Talk to us a little bit more about that, especially how do you break through a teenager who may not want to talk?
That's a hard nut to crack.
It is.
That is a very hard
Nut's
nut
a good
to crack.
word.
Yes. I think here's the long part of the answer. We start that process when they're 2 and 3. It's hard to talk to a 15-year-old when we've never talked to them before. So we lay that groundwork early on if we can to let them know that I'm open, I'm honest, I'm going to listen to you, you're going to get feedback. You may not like it, but that's okay. But if we haven't made those steps when they were much younger, to really let them know I'm here, I know you're struggling, and if they are in bed, curled in the covers, to go in and check on them, to let them know that I care, I love you, I'm here for you, I notice you're doing some things different, I'm worried about these things, and really to have if you have concerns about your child's safety, to be explicitly blunt. Are you feeling like you want to kill yourself? Not harm yourself, are you not feeling okay? But if you have those legitimate concerns, to really ask the questions. We are sometimes scared by the answer, but it's important to ask the questions of concerns about our kiddos and to really let them know that we're there for them. And if we can't crack that shell, maybe uncles or aunts or grandparents have a really good rapport with our kiddos and can ask those difficult questions. And so that's bringing in the village that we all hopefully have around us, that we can have someone else step in and do some of that work. And if there's concerns, please call your mental health provider and get an appointment set up. And if you don't have one, please look on the KU website or call your pediatrician or PCP to get something set up, because there's support out there. And this is a very stressful time, so we want to support not just the kiddos, but us big kids as well.
So, you said something that's really important there. I think a lot of things are really important, but that bit about you talk early and often with your kids. Sierra here talked perhaps a lot as a child, and I do remember one time we're trying to drive across Kansas in the middle of the night, and because I was hoping they would sleep, and Sierra didn't manage to sleep, and instead had to talk for about an hour, maybe 2 hours, about why the moon was following us, and was distressed by that. And as a parent sitting in the back seat, I had to try to answer that question. It's difficult to get a 2-year-old to understand why the moon is following us across Kansas.
You shouldn't have done such a good job setting up the groundwork, making a safe space for me to ask
Here we go. Here we
Good
go.
job. Safe spaces are important.
They
need that.
are, and that is so. Sarah, do you think that children, and especially African American kids at your age, do they feel safe?
The short, hard answer is no. No, we don't. We don't feel safe. And we were taught at a young age that because we looked different, there were certain things we had to do to be safe. Some of that is making sure you're wearing a suit when you show up to a new space. Some of that is knowing how to navigate certain conversations and certain spaces so that you are safe and so that it's safe for any person who looks like you who comes after you.
And so just for our audience out there, white guy, Independence, Missouri, Truman High School, William Jewell College, Mizzou, I can't say that I had seen that, right? And when I went to high school, there was one African-American student there when I was a senior, and I don't think there was anybody who was Jewish. And so, pretty narrow experience. And then I meet my wife in medical school. We're lab partners, and it's like, we started getting along really well. We're good friends, and all of a sudden things developed. And I'm like, wow, I hadn't expected that. And then you see the world through different eyes, and it's an entirely different experience. And you can think that two people who have the same job go through this world with very similar experiences, but the reality, when you come from very different backgrounds, your experiences are altogether different. And I think that's what sometimes as a society we forget, is that we expect the world to look like it is through our eyes, and the reality is you have to see the world through somebody else's eyes, including your kids.
Yeah, taking the perspective of someone else, which can be really hard because even though we're dressed in suits, they see our race first or our gender first, and so we have these, and the implicit bias is a real thing. And so when we think about what's the first thing you think of when you see someone, it's typically these really quite visible features of ourselves, and so that can be a barrier, because what if I am this psychologist who actually knows things, but you don't see that in me because of my race? And so that can be a barrier and make it not feel safe. Because
and then that's such I would think, a chronic toll for mental
Correct.
health. And again, I just draw the correlation. When you can't be seen because you're in a home, you can't establish friends, and you're trying to Zoom people, providing Zoom works, that's one experience, but imagine that through this concept of your life. So, Jill, another question.
Yes, Brandon writes, how do we make it safe for children to see family or friends? He goes on to talk about, I think the children that he's talking about are under age 12, and he's confused about all the studies that are coming out. They seem contradictory.
All right, let's talk about how to make it safe. First, let's say, Dana, can we make it safe for kids to see each other? Because things, man, the children's stuff has kind of changed a lot. Even this week, new information suggests it's changing a lot about how much kids infect others.
Yeah, I want to address that first. Certainly we know that every day new research is coming out. Our United States experience is a little bit different than some of the other countries, or at least what has been published. I think that point is very valid. We are still trying to learn about this. As it evolves, we will have better information. If some of the new research is true, that means that pediatrics are probably less apt to spread it as much as we thought they could. We certainly know that for the most part, children have less severe disease, and a higher proportion of them have less severe disease and may not even have it at all. So I think there can make it know that they can't really probably physically distance very well, but you can still do other things. Certainly, as we talked about before, encouraging outside play I think is important. And who's in the bubble? Yesterday we talked about, or the other day we talked about engaging of the really discuss those types of things. Who's in the other household bubble, things of that nature. There are ways to mitigate risk, just as we have talked about individually mitigating risk if you're trying to do anything such as travel.
Danielle, advice for us about that. And again, I'm remembering that we had some folks from Children's Mercy and an infectious disease doctor there a couple of days ago visit with us and said, hey, gosh, there's some pretty interesting evidence out there right now that kids are not spreaders of this disease. Adults are spreaders, but the kids may or may not be even sick with it, but they generally don't spread it. So if people hear that, there's a time to let your kids run out and play. I'm not sure about that. The data is pretty early, but man, maybe we ought to make sure that their mental health is intact.
Yes, and so I think finding some creative ways to make sure our kids can connect. And so I've seen people do car drive-bys. They drive by a friend's house and they hang outside from each other from 6 feet away, and they interact, they talk. Or they may ride their bikes next to each other in a parking lot where they're 6 feet away. But being creative with getting your kids with their friends is important, because we just know that kiddos being isolated is just increased anxiety, increased depression. And for those kiddos that may be burgeoning with some psychosis or substance use, this may open Pandora's box, because they are isolated, to go to dabbling into things because they've got nothing but time. And if a parent's working, even if the parent's downstairs on their Zoom call, they're downstairs for 8 hours on their Zoom call. So making sure that we have some creative opportunities to get kiddos engaged. And if there's, again, any concerns with how your kid's functioning, to make sure that we get them seen. We get them to talk to someone, to have a trusting, safe place to kind of get all those things out, bringing the family back into those therapy sessions, but making sure that we open the door in communication and dialogue. And I when kiddos are in school, I always ask, what was good about your day? What was not so good about your day? Some of those routines should not change because they are not physically at school, but to still ask at the end of the day, what was good about today? And what was not so good? And what would you want different for tomorrow? So to make sure that some of the routines we have for school, we still carry them out. They just look a bit different.
That's a good point, and you want. I think you said you noted there for a moment about the Zoom calls all day long. I know if I was working from home, or the day I tried to work from home, it was on call all day long. Had I had a kid in the house, I may have been in the same house, but I would not have been in the same space.
Idea.
And I wouldn't. And I don't. It may have even been worse for them. I don't know. But I think that's a struggle. And again, the 12-year-olds. I think part of it is, if you want your kids to be outside, I think being outside is really good.
Yeah.
Outside is always good, and B, it's better as far as an infectious disease standpoint and infection control. So I would want kids to get outside and play, try to maintain some distance, but recognizing, the COVID-19 journey is a struggle, and we are learning a lot as we go along the way. But if you think your kids aren't safe and they're going to be a little better off if they go outside, keeping them sheltered in place because of fear of COVID-19, bad idea. Yeah. Having your kids be safe, that's a good idea. And we all have to balance all these recommendations in our own life. I suspect you're hearing that from some of the folks you talk to, Sierra.
I am. I'm hearing it a lot. And one thing that concerns me as someone who is working in healthcare is that folks aren't always able to get the resources they need to get through the day. And luckily, your local health department is there and ready to help you if you do need some resources, whether it's getting medications or whether you need help with groceries. Your local health department is there to help you. So always reach out to your local health department to get the resources you need.
That is an important point. You know, we as physicians sometimes see the world about how we affect healthcare, but the reality is there's a public health, not just a personal health, that's really important. Jill, another question.
Yeah, just a real quick, kind of quirky one. Donna works apparently in a library, and she's wondering, do you need to quarantine the books for several days
Okay, do we
after
need to
someone checks
quarantine the
one
books?
out?
Dana, I think we've kind of gotten away from that whole thing, and we don't wipe down surfaces like as much as like if you get a book in, are you gonna wipe it down? I don't know that you need to do that.
No. I would agree with you. I don't think there's any need to quarantine such as returned books. Really, the virus is not going to survive in general on many surfaces for any period of time. I think if you are working with those books, the more important thing is just going to be maintaining good hand hygiene and really trying to avoid touching your face. But for the most part, you know, the books or other types of things like that, if they're being returned to the library, are really not going to pose much of a risk at all.
Barbara says, can you please speak to the effect of social isolation on the vulnerable population of long-term seniors? She knows it's a problem. People are asking for help.
It is. Okay, Danielle, what do you think?
That is such a hard question. I think inherently before, seniors were more vulnerable and socially isolated kind of as a baseline. And so now that we have this policy in place to keep them safe and keep us safe, that is difficult. So I can't think of the organization I saw in the news probably a month ago that's actually intentionally having these Zoom calls. They're pairing seniors with community partners to make sure that they have this connection. There are letter writing campaigns to make sure that our seniors are having some correspondence. So I keep saying this, finding creative ways, but I think we are in this space of finding some ways to maybe connect. If we can have some visitation where they're in their window and we are there, but connecting our seniors with the things of their youth has been important, especially for those that are having some memory issues. What things can we do to help them connect to the things that they do remember and can hold on to? But finding opportunities for what would be ideal is to have a letter writing campaign between our kids at home that aren't doing school right now and our seniors, and to really pair these two populations are really isolated right now together. And the history that can be shared would be, I think, quite amazing if we could
You do
push
things
that through.
like that.
Yeah.
You know, my mother-in-law is 87, and we had her get out of her independent living situation. But for a lot of folks, that's not an option. And they are in that independent living, and they don't get visitors, and they're not supposed to go out.
Yeah.
Wow, that's really hard. And you know, televisions are good in some regards, but you can't get a hug from a TV,
No.
and so that doesn't work as well. And Sarah, have you had that occur on some of your calls or some of the things you've done with some of the folks?
I have, and one thing that always strikes me is the number of people who are at home by themselves. So they're at home by themselves, they're sick with COVID, and they can't go out, and they can't have people over. And that's really scary. I think that's really scary.
It
So
is.
first you're coping with the world as it is, you're coping with an illness, and then you also don't feel good, and you're at home by yourself. It's a lot of factors that can compound to have an even greater impact on your health.
That's a lot of stress. And one other thing I would just add, again, there's a balance here. And if you follow all the recommendations to the letter, and you're so mentally unhealthy that you're thinking about self-harm, then you follow too many of the recommendations. And I think you have to make a decision about what you can and can't live with. And at some point, if the stress of your sheltering in place is so great, you may have to go find someone else who thinks it's so great and have a hug. And you know what? That's okay. Because really, ultimately, if your mental health isn't there, it doesn't gonna matter what your physical health is like. And I'll tell you, in medicine, I think that so much of the disease I see has its roots in mental health issues. Now, I see a lot of patients with CF, and people who are born. There are a lot of mental health issues in cystic fibrosis. But if folks are unhappy, they don't do their treatments. If they don't do their treatments, their physical health deteriorates. You know, we're all in it together, and we just have to remember, I think, that part of it.
One thing we say around here a lot and at home a lot is there's no health without mental health.
Yeah.
I think that's just an easy way to remember it.
I think that there's a lot of truth in that.
We should get T-shirts with that made. I think we forget the fact that our brain's connected to the rest of our body, so what happens to us mentally impacts us. And so if we could have greater acceptance of the fact that we all do have struggles, and that depression, anxiety, bipolar, those are all real things, and it's not a character defect. It is a biological basis of how we are. And so if we can first acknowledge that and then actually kind of make it okay to go and talk to someone, and not be such a stigma to being able to take care of yourself, because you would never be shamed for getting your broken leg fixed. There should be no shame involved in getting the rest of your body up to where you want it and need it to be to function effectively.
I'm not sure the folks I work with always think my brain's connected to the rest of my body, but that's just a guess.
I don't think so.
You don't either. Thanks for that.
Consensus in that.
Love is a powerful thing.
I love the fact that she's here.
Yeah.
I love this daughter-dad dynamic.
Yeah.
Okay.
Here's the
Anonymous
truth.
is asking, and this person is pushing back a little bit. I think they really want to see family. And they're saying, if a mask is effective, why can't I just wear it and come and see who I want to at the hospital or a nursing home?
You know, that's a great question. And Dana, let's talk about that a little bit. You know, the masks are effective at preventing your secretions from going from each other. But if you touch your mask and you touch a surface, you touch a person, I mean, there are limitations to that. And sick folks who are already here, if they then get COVID-19, that's a really bad combination, Dana.
Yeah. We've talked about all of these things, and our main focus has been ways to mitigate risk. Not one thing is the panacea for everything. So we've talked about masks, physical distancing, hand hygiene. We have to do a combination of all of those things to reduce the risk of transmission of this infection as much as possible. And as you stated, there are vulnerable populations in the hospital. There are vulnerable populations in the nursing facilities. We don't want those populations to have it spread through there. And so those are reasons why visitors are discouraged or not allowed in some of these facilities. As we start to open up, that may change. But certainly those are the main reasons. And we have to remember, it's a combination of things. It's not one thing at all.
Yeah, it really is important. And remembering we closed the hospital initially because of a PPE and the fear of a surge. And the surge has not materialized, and it yet may. And we'll kind of get into some of that next week about what do we expect, and will there be another surge. But I think that the reason for closing down the hospital to visitors was to both preserve PPE, allow us to put our workflows in place, and make sure we protected from a surge, and make sure we kept our staff safe, because we have to have those staff to take good care of folks and to keep our patients safe. We've done a lot of things. We've got a lot of things in place, and hence we're starting to reopen. And in fairness, I think most of the hospitals in Kansas City, we have that combined CMO call, and most of them are either have already reopened to a visitor or are strongly considering it and deciding when to implement it. We know that it's taken a large toll. Just the thought of being in this hospital and being ill, and I've had some good friends in hospitals, and they can't get family members to visit them. That's really hard, and that's social isolation. And just think about what it would be like if you were isolated every day at home. And that's and then to be isolated when you're sick or you're struggling, or to be isolated for your life. We'll return to that theme in just a moment, but I think we have time for one more question.
Can we do 3 real quick ones?
Yes, ma'am.
All right. Jennifer wants to know, how safe is it really to send letters to a nursing home or mail in general?
Oh, I think it's really safe. I wouldn't be concerned about COVID being on a letter, going through the mail, and then ending up at a nursing home and making somebody sick. Dan, I just don't think that's a concern to you.
No, I agree with you. I think that was explicitly addressed, maybe even by Dr. Fauci and some of the CDC, so I agree 100%.
And you know, when we first started the COVID crisis, that was part of the teaching.
Yeah.
But again, we've learned so much, and you've heard us say on the plane, I think Jessica Callender-Rich, who's one of our geriatricians, said that, you know, getting through this pandemic is a lot like building an airplane while you fly it. And so at first, we were trying to give you everything we could to be safe. As we've learned more, we really know that surfaces, while a concern, aren't quite the same concern we have. early on we're saying wipe down your food, wipe down your countertop. I mean, really, I haven't come back to that same message for a while because we've learned a lot more about how the disease is spread. So letters, safe.
Especially for seniors. Great idea.
Yeah,
right?
what a great
Okay,
idea.
and Michelle says, what do you think about kids and teens going to the neighborhood swimming pool? I know they're kind of open
Neighborhood
on Monday.
swimming pools. Oh boy.
As a
Okay.
parent, I have a concern.
Here we go, Dana. The swimming pool conversation keeps coming back, and it's not the pool. The pool's really safe because the water's safe. It's the
Yeah.
side of the pool. It's the patio around the pool, or patio if you're from the deep south like my mother.
Yeah, I think we can reiterate that the pool itself, if you're swimming, if you're physically distanced, we don't see any risk there. You know, if you have some virus into the pool, it's really not going to be an issue. The issue is the lack of physical distancing. If you're sitting on the side of the pool, if you can maintain physically distanced in physically distanced areas, that's going to be good. Again, certainly we have talked about children and maybe not spreading as much, but I think these are all things that we need to continue to do to have individual responsibility and understand the dynamics of really the message that we're trying to send. Continue physical distancing, try not to congregate in large groups. The pool itself is going to be safe, but otherwise you have to understand those other pillars that we've been talking about.
And finally, Diane asks, I have a question on how long I can reuse a mask. I use a level 1 when running errands. I put it on the sun and the dash after running errands. Can I just keep reusing it, or should I get a new one?
Well, Dana, I've tried that strategy before. What do you think? Sun in the dash. I like it. It's hot. Warm in the car. There's time in between, but those level 1 masks, I don't know about the fabric.
Yeah, I think we probably wouldn't want to do it too long, and I don't have really good parameters on too long. If you're running in for a 10 or 15-minute errand into the store, and then when you come out, you do hand hygiene, remove the mask. If you're putting it on the dash, certainly we think that the UV light is probably going to have some effect in reducing any bacterial or viral contamination of the mask. I would say you can probably reuse it a few times. Again, it will break down. We understand that. When we use it in the hospital, we don't use these level 1 masks for too long of extended use, not more than a couple hours. You could probably get away with using it a few days for short errands, but I wouldn't probably go any longer than that.
All right. Well, as we wrap up today, I'd love to have some final comments, Danielle, from you and from Sierra, and then we'll kind of close up the show.
Perfect.
Go, no, you go first, because this is a setup, guys. I've got this all in my head. It's all set up. That's the reason I looked at you first. You're so nice.
I really want people to know that to take care of themselves, take care of their children, make sure there's open dialogue and conversations. If you see a concern with your child or your loved one, whether they be a child or an adult, to ask the question, to check, to say, are you okay? What can I do? We should talk about this, to make sure that we are having open and honest conversations, developmentally appropriate, that we are doing our own level of self-care, that this is a new normal, and that balance is what we need. And so nothing will be perfect. And so to be able to find some balance of doing what we need to do for safety from COVID, from safety from social issues, but also that we get to actually experience life right now. And so if the fear is so much that we can't enjoy things, our mental health is declining, that's like a big red warning sign to take care of yourself and to get some support and some help for yourself. I think as we continue down the path of figuring out COVID and how to respond to it and the social issues, that we as a community have some really open and honest conversations, as well as to what we can do to all be stronger and more united together.
Yeah, stand together makes a lot of sense. Sarah, you posted something on Instagram yesterday that brought a tear to my eye, and I don't know if you're willing to share that, but this question of invisibility, both with COVID and then through weathering, and the concept you mentioned about people who society may not hold up as much value over a long period of time, and a toll on mental illness. That's a really big deal.
It is, and it's hard to feel seen a lot of the time, and I think this time of COVID has, as we've talked about, has made other folks feel that they haven't been seen and that they can't be seen. But for a lot of communities, that has been true really for centuries. And so as you go about your day, I think we all have to ask ourselves, we've talked so much about social responsibility in our family, and I know that you've talked about it here. So as you go about your day, I would ask yourself, what can I do to see the people around me? What can I do to make sure that they feel seen? And what can I do with the privilege that is afforded to me, either based on your race, based on your gender, based on your socioeconomic status, based on your education? What can I do with that privilege to better serve my community?
You know, my son, I tried to call him last night about 10 o'clock, and he's gone down to the protest a few times, and I couldn't find him, and I got a little nervous because I thought, oh gosh, don't go down there, don't, just be safe. And it is a different challenge for African Americans, and I think it does affect mental health because of that isolation that can occur. And again, I just draw that relationship with what it's like to have to shelter in place, and then think in some ways you have to shelter in place for all your life and worry about that. So what are the effects of COVID? Wow, there are a lot. And as a society, we have felt that toll, whether it's through unemployment, anxiety and depression, social isolation. In some ways, you wonder if all of us aren't starting to protest against what we see out there. On Monday, we're going to talk a little bit about modeling again and where we are. I think as we think about reopening and we continue to reopen society, it's important to get a measure, because we're seeing a lot of new cases of COVID, but it's not translating to inpatient admissions. We're going to talk about why that is. And we'll probably tie back into a lot of these themes that you heard emerge today, because it's clear there are mental health issues related to job loss, there are mental health issues related to isolation, there are mental health issues to institutionalized challenges to different populations. There's just a lot of mental health issues that we ought to address, because this health system has 130 beds that are devoted to mental health causes, and they're full. And that's something we need to talk about. So thank you for being with us. You hear us all the time. We tell you to stay sheltered in place. There's no place like home. Balance that against what your own personal needs are and how the world affects you. And remember, while you take a walk outside, think about what it's like to walk in someone else's shoes. We'll be here on Monday. We hope you're with us. Have a great weekend.